Hi, Karen. So right now we're going to do an integumentary assessment, peripheral vascular assessment, and also an ear and nose assessment. Is that okay with you?
Mm-hmm.
All right.
Okay.
So we're going to start with inspecting the skin. Remember that you're going to do this with the patient without a gown on to really inspect all of the skin, but for video purposes, the patient will have her clothes on. So I'm going to look anteriorly and posteriorly. Skin is even and consistent with genetic background with no lesions. I will now palpate the skin to check for any moisture, temperature, turgor, edema, and capillary refill. Okay, Karen, if you could just put your arms out for me. I'm just gonna lightly touch your arms, okay? All right. And I'm also going to check for capillary refill here. Okay, so skin is warm and dry bilaterally. I'm also gonna check your legs, okay, as well. All right, skin is also warm and dry bilaterally. The upper and lower extremities have 0 out of 4 plus edema and no signs of dehydration. Capillary refill was also less than 2 seconds on the upper and lower extremities. Okay, Karen, so now I'm going to be checking your peripheral pulses. I'm going to be checking each one for its rhythm and strength. If I can have you lay down for me. You can scoot yourself up. Yes. Okay, so I'm going to start with the carotid pulse. Okay, rhythm is regular and 2+. I'm going to do the brachial now. Rhythm is regular and 2+. I will do the radial, regular and 2+, the ulnar, difficult to palpate, but that's also normal. Femoral, also difficult to palpate, slightly faint, so I would say 1+, but regular. Popliteal, I'm going to ask you to just bend your knee a little bit, flex it for me, and I'm going to go behind the knee. Also difficult to palpate, which is normal. Posterior tibial. This is regular and 2+, and dorsalis pedis, regular and 2+. All right, Karen, now I'm going to use a Doppler to check one of your pulses, okay? So I'm going to check for the brachial pulse with the Doppler. So I'm going to put a little jelly onto the site. It's going to be a little cold, okay? Now I'm going to turn on the Doppler machine. And now I've found the pulse site once I hear the swishing and whooshing sound on the Doppler. Okay, very good. Normal. Okay. All right, Karen, so now I'm going to inspect and palpate your ear. So the ears, can you just turn your head for me as well? Great, okay. So the ears are of equal size bilaterally with no swelling or thickening, and the skin color is consistent with the person's facial color. Pinna, which is what I'm palpating now. Okay. Any pain, Karen?
No.
And this is the tragus. Pinna and tragus are firm and no pain noted. All right, Karen, and lastly, I want to inspect and palpate the nose, okay? So your nose is symmetric and midline and in proportion to all your other facial features. Now I'm going to palpate the nose. I'm going to palpate one nostril at a time, and I'm going to ask you to sniff to check if there's any obstruction, okay?
Okay.
All right, so sniff for me. Good, and sniff for me. Good. So no obstruction noted in nostrils bilaterally.